First of all, congratulations on this tremendous effort. A lot of people, though, especially when you look at the pictures coming from India, say, could this not be done sooner? A lot of the shipments are into 2022. Can we get it done quicker?
Well, first of all, thanks for having me. We have been working for several months to establish this agreement and also to obtain WHO emergency use license, which we did last Friday. And the discussions have led to the announcement of 34 million doses being available later this year. It's really a question of our supply obligations throughout the world and our production capacity. And we're ramping up our production capacity as quickly as we can. We're producing roughly 1 billion doses this year at a maximum. But next year, we also announced we'll be increasing to 3 billion. So we are working as a manufacturer absolutely as rapidly as we can, as are others. Look, the reality is that there's a number of countries that have also sourced the vaccine, and we hope, together with our supply, some of the countries as well will consider what their needs are so that we can get
Noubar,
as many doses to the rest of the world as we can.
What can you tell us about pricing?
We have used a tiered pricing system with this being at the absolute lowest price. It's been negotiated. There's a transparent way in which we've gone about it with the various entities, countries that we deal with, as well as Kovacs. And so we haven't said much more than that, only to say that we certainly take into account the purpose of the Kovacs facility, particularly as it gets to lowest income countries, the 92 Gavi countries. We're very, very pleased to be able to tap into that and bring our technology, our capability to bear.
How worried are you about new variants circulating that have not been identified because a lot of countries have not been vaccinated yet?
We are worried about that as we were about the virus last year, in the sense that there's an element of the unknown. Now we know a lot more about the parent strain that we were going after. As you know, we have begun human trials very rapidly on a variant vaccine against the South African strain, as well as a booster for the original vaccine, and in fact also a combination. And uniquely, Moderna has shown data in animal models, and we hope soon to have human data showing efficacy for the variants. But then, as you say, variants are beginning to spring up with yet different properties, and we're going to have to stay vigilant, potentially developing yet more boosters. And we hope to keep this at a minimal challenge in terms of how many different approaches we need to have. But at the end of the day, the virus is doing its own thing, and we need to be able to stay ahead of it.
Will you be able to maintain production goals for next year? Are we still going to see, 3 billion shots produced by Moderna next year?
Yes, we increased our forecast because of significant investment that we're making as we speak ahead of that to 3 billion doses. I'll also say that we're actively testing doses that are lower than the original vaccine that we went as fast as we could last year to produce. So to the extent that we can get the vaccine, which today is at 100 micrograms, to show effectiveness at even 50, of course, that will instantaneously double our output of doses as well. So we're doing everything we can, recognizing the need far, far outstrips what we had anticipated, especially given the alternative vaccines that are also coming out and concerns people have with variants. So yes, we are committed certainly to do everything we can, investment being a big part of that, expertise being brought to bear, and we hope that we'll meet our goals as we are doing this year.
Noubar, on the point of variants, and going back to what you said earlier about potential booster shots, trials you have to have the vaccine address different variants, does that mean that the shots you're rolling out to Kovacs in 2022 are going to look different than the shots that are currently going into the arms of people today?
We will work with our Covax partners to ensure that we have the most effective vaccines for the conditions that we need to go after. So that is indeed an issue that's going to require some level of forecasting depending on where we are. But what the overall structure certainly has a supply number in mind. Exactly what that consists of, whether it's primary vaccination or it's a boost, as well as whether it relates to variants, that has to be worked out, by the way, with Covax as with everywhere else.
How far out does your production planning go, Noubar? Do you have plans going out for investment in production in 23, in 24, in 25?
Certainly, we're looking into 23 as we speak. We have said publicly that based on the best available information and our own work, we believe that this virus may well end up taking on an endemic character in the sense that there may be enough variants that we start seeing some form of it in various kind of seasonal fluctuations. So, it's not a sure thing, but it may well settle into a behavior that's similar to seasonal flu. We don't know that for sure yet, but we need to be prepared. One thing we've learned from this pandemic is that we can't hope for best case situation, prepare the least for that case, and then find out that it's not that. And so we need to do the opposite. So I think, yes, we are looking at 2023, but indeed, if we can get up to 3 billion doses, and if we can get even lower amounts per dose to show the same effectiveness, that will start putting a pretty significant dent on the global demand alongside our colleagues in the industry who are also using the mRNA technology to increase supply yet more.
With hindsight, Noubar, what should we have done differently with Kovacs?
Well, look, Kovacs has been stood up under an emergency situation and has faced a very challenging situation because on the one hand, they needed to secure support from countries and other institutions, even while trying to cut deals with vaccine manufacturers, which, a mere 3-6 months ago, the picture looked different as to which vaccines to source. So they did, I'm sure, the best that they could. And what they're finding is that the situation is shifting. And we're just pleased, although it's been many, many months in the making, that we're able to reach this milestone. And I look, being in the trenches in some level, Moderna as a company for so many months and watching our colleagues in OWS in the US, the NIH and others as well in the trenches, I have sympathy for others in the trenches that are likewise trying to figure out what's the best that can be done. So I just want to encourage them to keep going.
When do you think the world, and I know this is a big question, will actually reach herd immunity? And do we need to vaccinate children to reach that point?
Again, there's a bit of speculation involved in that, but I would say given the seriousness of the disease, vaccinating children seems like the better approach than not, because one of the things that nobody is factoring in is what the downstream health consequences of this disease are post-infection. The notion that children don't get a hard version of this is one thing. The notion that that won't have later stage effects, I think, is just an unknown. So herd immunity is something that I think will only be judged in hindsight. When we see the burden alleviate, then we're going to say, oh, in hindsight, we reached herd immunity. People are talking about it as though it's a knowable thing. I don't believe it is. I certainly think we should get as many people vaccinated as quickly as we can. And of course, throughout the world, because otherwise we're just not going to be able to contain the virus as we're seeing today in India and elsewhere.